All right, getting your teeth cleaned, right? It's something I grew up doing every 6 months, twice a year, keep them fresh. But all of a sudden, that's not necessarily the case because of the pandemic we're experiencing. To talk about the dental industry as a whole, we're joined by Dr. Cynthia Brattesani from the California Dental Association. Thanks for being with us, Doctor.
Great to be here with you, Mike.
I mean, I
Thanks.
was just reading an article in the New York Post about people actually at home pulling their teeth because they just can't get it into dental offices right now. Are you hearing stories about this?
Well, not in California. It looks like we're doing really a great job in helping patients. We're on call and our specialists as well. And so we're seeing patients every week. So we're trying to flatten the curve and not be at the office every day, of course. But if
Right.
patients need dental emergencies, we're there.
Okay, so when you say dental emergencies, just like that, what are we talking about? Root canals? What does it take in order to get into a dental office in California now?
Right. We're suggesting patients, if they have any kind of pain with or without swelling, if they have any kind of trauma, like they got a tooth knocked out or a tooth cracked, if they have any kind of swelling or uncontrollable bleeding, they need to call us. I want you to know that any question, big or small, just give us a call and we'll help you because there might be home remedies you can do.
Okay, so when it comes to just getting your yeah, just a cleaning, like I mentioned at the top, right? This is something I do twice a year. My family does, my children do. Is that not recommended for individuals to go in and have those done?
Not right now, Mike. The CDC, the California Health Departments, and the California Dental Association know that we need to actually conserve PPE for our frontline workers and also help flatten the curve. So those things are on hold at the moment.
Okay, so if I do go in, and I'll just keep using myself as an example, but I needed a root canal, there's an emergency. What's it going to look like? I mean, how are dentists now suiting up? Are they doing it as the whole look just different?
Yes, so there was pro-COVID infection control, and now there's post-COVID infection control. Now, just before I say that, I want you to know that we're infection control experts because we've lived through the AIDS epidemic and the highly virulent hepatitis B and C. So we know what it takes to be safe. However, with post-COVID, we're actually underlined by the interim guidelines of the ADA to do some things differently. So for instance, we'll do some pre-screening questions before you come in. We won't have people coming back to back. We're going to reconfigure our waiting lounges so that people are not there piling up. And we're going to have like alcohol stations for your hands. We're going to do pre-rinse rinses for you of hydrogen peroxide to help lower that load of the virus. And then we're going to be dressed a whole different way with screens. And when we're doing work in the dental, in the mouth, we're going to be able to use isolating devices to help with that.
Okay, and so when someone comes in, I mean, are you actually asking them, have you had COVID-19? Anyone in your family have COVID-19? And if they're answering, yeah, I mean, obviously yes, if they have it themselves, then you have to refuse them.
Well, it depends. We are taking temperatures, and as you know, they could be having it and we don't know. So
Right.
we're going to make assessment as needed. And if it's a problem, we have some dentists that are set up for hospital settings with private rooms, and we can help there.
Okay. Hygienists, dental assistants, I mean, all you dentists out there, I mean, you're at high risk in general of this. When you talk about the mask, when I walk in and I'm picturing my dentist right now and what she wears, but it's definitely not the N95. I'm curious, is everyone in the offices, are they wearing those N95 masks?
Well, that's the interim guideline of the ADA is recommending we do that to keep everybody safe. However, there's a shortage of PPE, so we're having a problem there.
Okay. What about just the whole social aspect of it? I mean, did you know, have you heard stories of people just happy, albeit emergency, but to come in and just socialize with someone outside of a home setting?
Yeah, well, we're having a real hard time with that, like the rest of the country and the world for that matter. So we're being very careful. We as dentists want to help flatten that curve and not spread the virus. So we're doing everything possible. It's important.
Yeah. Do patients actually wear gloves? I mean, are they having to wear protective gear themselves? I mean, obviously not the mouth and the mask, but what about their
Well,
hands?
certainly if they want to, but we have these alcohol stations. It's helping us a lot. And then we'll be able, when we're ready to start working again, we'll have people cleaning areas constantly to make sure everything is super clean.
Okay. What about filtration systems? I guess it depends on everyone's office and how they're set up, but just the air. and the circulation. Any concern about that?
Well, crisis breeds innovation. So I want you to know there's a lot of things on the market now through our dental suppliers that are finding out through dental offices what we might be using. There's these sterilization units for the air and suctions for aerosols. We're going to be able to look at all that technology and see what we can do to add layers of safety to already what we do.
Okay, you mentioned it a little bit earlier in the interview, but um, especially you being out there in the Bay Area with the HIV and AIDS epidemic in the early '80s and late '80s, and PPE and how things change. Do you feel the industry is going to change in regards to what dentists actually wear when they're on the job, and hygienists and dental assistants?
Absolutely. Until there's a vaccine out there, we need to keep our staff safe, our dentists safe, and eventually, when we're doing that, the patient safe. So definitely, there's going to be a big change.
Okay, what about the financial aspect? I've done so many interviews from so many different industries and people taking a hit, businesses taking a hit. Um, can you give, I don't know if you can give an example of your own personal business or others about what kind of percentage of business is actually down? Uh,
I'm so glad you asked that. If you look at up and down California, most dental offices are small businesses. They're employing 10 staff members or less. So they've been hit extremely hard. And because it takes a lot of money of overhead in order to run a dental office with the technology and the equipment we have, they've been devastated and have to let go of their staffs and some even furlough. And so we are really relying on those federal and state economic packages. With this second round of funding, we hope that more dentists get some of that relief.
yeah, you talk about the Paycheck Protection Program. So people apply for that first round, and if they didn't get it, obviously they're going to apply again and get as much as they can here to survive.
Exactly. In order to keep the lights on, a lot of these dentists are going to need that for sure.
Okay, dental work. I guess some consider it a bit of a luxury, um, to do special work and so forth and so on. But what about the recovery just down the road, doctor? Do you expect a slow recovery when it comes to opening up offices, getting cleanings done? Even post vaccine.
Right. Well, at first, I know that we're going to have to spread patients, so we won't have that high productivity. But Mike, dentistry, overall health means dental health. And the hallmark of our profession has always been preventative care. So we're definitely going to work really hard in order to ensure the safety of the patient, make them come for that preventive care. And it might be slow at first, but we're going to do everything possible so that we can take care of our patients' health and that of the public.
I wonder if dentists who are, maybe closer to retirement, maybe 3, 5 years away, are now reconsidering. Well, maybe I just closed the office, earlier than I thought, and instead of the hassle of trying to reopen, especially if there are recommendations that you can't have as many patients, right? And if you're paying the same lease amount, if you don't own your building or your office, and that doesn't change, but then your income is cut 30, 40, 50%.
Yeah, no, that's a very, very important comment. And there are some dentists that are on the older side that might have some health issues. And so they're reconsidering. We need to, the California Dental Association's helping. We have a task force looking at all those different things that we can help dentists. So we hope that we can help them soon. And we need to take care of our patients, and we need dentists in the state.
Yeah. And I guess the follow-up question to that is if there is early retirement, will we have enough dentists in California? I'm not sure how many are studying to do just that currently.
Well, yeah, we have 6 different dental schools in the state. And of course, they have to graduate now without a graduation, poor things. But the point is that that's always a concern. We never want a shortage in access to care. So the California Dental Association is doing everything possible in order to study that.
Okay. Before we let you go, anything else, doctor, that you want to get across to all our viewers out there?
Well, we just want you to know that we as dentists are really happy to take care of patients during this time for emergencies. So please call us. We don't want to burden emergency rooms with dental issues. We can take care of you. Stay healthy, brush your teeth twice a day, a full 2 minutes, floss, use fluoridated toothpaste, stay hydrated, take your vitamins, no sugary drinks, no acidic drinks, and we'll be there waiting for you when you return.
Twice a day. That's something my 7-year-old just can't seem to get a grasp on yet. We're still working with her on that one.
There you go.
Dr. Cynthia Brattesani with the California Dental Association. We appreciate the conversation. Thanks for all you do, and stay safe in the weeks and months ahead.
Thank you, Mike. Stay safe.